So, what do I do as a forensic nurse examiner? This video is going to be all about what I do as a forensic nurse examiner and maybe a little bit about a typical day in life. So as a forensic nurse examiner, I see all victims of violence. Now, state by state, program to program, every forensic nurse examiner job and sexual assault nurse examiner job is going to be a little bit different because every program is different. But in my job as a forensic nurse examiner in the hospital that I work in, we have our own area with 5 exam rooms, and we are located inside a level 1 trauma emergency department. So we see all victims of violence. That includes anybody that is a victim of assault or victim of violence. A lot of different things can fall under that category. For example, some of these are sexual assault victims, domestic violence, which you will hear me say intimate partner violence. That is the term that we use for domestic violence in this role. So sexual assault, intimate partner violence, child abuse and neglect, elder abuse and neglect, and physical assault. And that includes anybody that gets in a fight with another person, a lot of bar fights. That also encompasses gunshot wound victims and stabbing victims. We also see victims of human trafficking. So what can we do for each of those patients? So let's start with a sexual assault patient. We can offer a lot of different things. We can help them report to police if they want to. And then we can do what we call a medical forensic exam. That's a lot of things. So that includes photo documentation of body injuries, of bruises, scratches on their body, anywhere. And then it also involves a anogenital exam that we have special camera, special techniques that we use to look for injury, different things like that. We also can collect evidence, so swabs off the body. We can collect clothing for evidence, and then also the photos are evidence as well. So you guys are probably thinking like, what could you really do for a gunshot wound victim or a stabbing victim? Well, for one, sometimes in the hospital, those victims walk in and law enforcement has not been called. Like there's, nobody has gotten the story as to what happened, how this happened. They usually are moved to a resus bay and worked up as a trauma, either a limited or a full trauma. I know every hospital has different alert calls for that, but we use limited trauma and full trauma. And so my role in that is to kind of facilitate those mandatory things that need to be done. So for one, I'll get with the charge nurse and say, hey, has anyone called the police yet? And that has to be done as soon as we have a gunshot wound or a stabbing walk in. If that's not been done, I'll go call the police. If that has already been done and they're already alerted of what's going on, then I usually stay in the resus bay area and I will provide brown paper bags and, anybody who comes in as a trauma, you're getting your clothes cut off, but I can help collect those clothes as evidence because once the police do arrive, they're going to want those clothes as evidence, things like that. So there's a lot of different things that I can offer. Now, when the patient is stable and they're able to talk to me, this may be after they've gone to surgery and they're up inpatient, or this may be in the resus bay and then they're just stable and they're trying to decide if they're going to be admitted or not. So in that stage, then I can go and offer them photo documentation of their injury. I can take down a history of what happened, document that in their medical record, get a good head to toe, and then just kind of help facilitate the law enforcement involvement, what it's going to look like next. So a typical day as a forensic nurse examiner is kind of hard to explain because, and another reason why I love the job is because every day is different. You literally never know who's going to walk in the door, so you just never know what to expect. And anytime your phone rings, forensic nurse, this is Olivia, it could be any of those victims of violence. We also get called sometimes with, patients that have some odd safety concerns, maybe not a safe plan. Sometimes it's hard to decipher whether social work needs to be involved or if it's us that needs to be involved for the criminal side of things. Sometimes they intertwine and we can work together to kind of come up with a safe plan for those patients, but that's another thing that happens often too. So in my specific job, I do work 12-hour shifts. I work 3 12-hour shifts. Well, I work more because I pick up overtime, but my full-time commitment is 3 12-hour shifts a week. And I do work 7 a.m. to 7 p.m. and then we have full coverage 7 p.m. to 7 a.m. as well. We're very robust, very just amazing program with a lot of resources, so I'm very lucky to be working where I'm at. Back to what a typical day kind of looks like. So I come in at 7. Sometimes there's a patient waiting for me. Sometimes there's not. Sometimes it's several hours before I get a call for a patient, but there's a lot of other things that I can do in my day that can take up the time if I'm not with a patient. So we do have a follow-up log where maybe a nurse overnight or even during the day didn't have time to go see a patient that is admitted inpatient, then we can go hit that follow-up log and kind of go see those patients and see what's going on and offer all of our services to them even while they're admitted up to the floor. I can also do, we call it QA, so quality assurance, and that is just me as a forensic nurse looking at a coworker, another forensic nurse's documentation. So we pull up the chart, we go through their entire documentation, pretty detail oriented, and go through every little thing that has to be documented. And it's not to like make anyone feel bad or tell you like, oh, you forgot this. It's really just to you know, make sure our charts are good and it's quality documentation, because we do have to testify in court. It's also just a good learning process for those that are newer forensic nurses to kind of look at other forensic nurses' documentation and be like, oh, I like the way that they said that. I'm going to start using that in my practice. So it's actually a really good thing that we do. My program is constantly starting new things. So right now I have a lot of projects I'm working on. I have a PowerPoint for pediatric ingestion that I'm working on. I have a PowerPoint that I'm working on for one of our local police departments. I am working on coming up with the flow and kind of understanding how to start up a follow-up clinic. So there's always something to be done, even if you're not with the patient. But our program is so busy. We see anywhere between 200 to 300 patients a month. So yes, I know that number is kind of shocking, and it is kind of sad, but that's just the world we live in. There's a lot of violence out there, and I like to even say that like I don't live in a city that's known for a lot of crime and violence, but there's still a lot out there, and the fact that we are there for those people is incredible. So this is kind of a short video for you guys, but I hope that helps and kind of helps you understand what it is that a forensic nurse examiner does. Bye.